Do you know how many new mums experience postpartum depression? A surprising number of new mothers grapple with this often misunderstood condition. Postpartum depression isn't just the baby blues or a mere bout of moodiness. It's a serious condition that can leave mums feeling empty, overwhelmed, and utterly alone. And yet, it's more common than you might think. Today we're going to shed some light on postpartum depression and why it's so important for every new mom to be aware of it. Postpartum depression doesn't always look like you might expect. It is more than just the typical baby blues that some mothers experience after giving birth. It's a serious mental health condition that can occur anytime within the first year after childbirth. One of the most common signs of postpartum depression is a persistent feeling of sadness or emptiness. This isn't just the occasional teary moment or a passing mood swing. This is a deep, lingering sadness that refuses to go away, making it hard to enjoy life or even get through the day. Another sign to look out for is difficulty bonding with the baby. You might find yourself struggling to connect with your newborn, or you may feel indifferent or even hostile. This doesn't mean you're a bad mother or that you don't love your child. It's a symptom of a condition that needs attention and care. Postpartum depression can also lead to withdrawal from family and friends. You might find yourself avoiding social interactions, even with the people you love the most. You might feel like you're alone in your feelings, or worry that you're a burden to others. Changes in appetite or sleep patterns are also common signs of postpartum depression. You might find yourself eating too much or too little, sleeping all day or barely sleeping at all. These disruptions in your normal routines can be a clear signal that something is off. It's important to remember that these symptoms are more severe and long-lasting than the baby blues. If you're experiencing any or all of these signs, it's crucial to reach out to a healthcare provider. There's no need to feel shame or embarrassment. Postpartum depression is a medical condition that can be treated, and it's not your fault. Recognizing these signs is the first step towards getting the help you need. You're not alone, and you don't have to face this by yourself. There are resources and support systems available to help you navigate through this challenging time. Remember, seeking help is not a sign of weakness, but rather a sign of strength and the love you have for your child. Postpartum depression doesn't just affect the new mum. It's like a ripple in a pond, touching those closest to her, particularly the bond between mother and baby. This precious relationship can be strained, as the mother may struggle to connect with her newborn, which is often heartbreaking for both. It doesn't stop there. The family dynamics can shift, adding a layer of stress and tension to the home environment. Partners may feel helpless, not knowing how to provide support. Siblings might feel neglected as they grapple with the sudden change in their mother's mood and behavior. And the long-term effects? If left untreated, this form of depression can persist, affecting a mother's ability to nurture and bond with her child. This could potentially influence the child's development and emotional health in the future. The impact of postpartum depression is far-reaching, affecting more than just the individual mom. Remember, it's not just about you, but also about the well-being of your little one. If you think you might be dealing with postpartum depression, you're not alone. It's a common experience shared by many, and it's crucial to understand that there's no shame in seeking help. One of the most effective ways to cope with postpartum depression is to seek professional help. Talk to your doctor or a mental health professional about what you're feeling. They can provide strategies for coping and suggest treatment options that are right for you. This could include therapy, medication, or both. Joining a support group can also be incredibly beneficial. Connecting with others who understand what you're going through can bring a sense of comfort and community. You'll find that you're not alone in your struggle, and you can learn from the experiences of others. Remember to practice self-care. It's easy to get caught up in the demands of a new baby, but you can't pour from an empty cup. Try to eat healthily, get enough sleep, and take time for yourself each day, even if it's just a few minutes. It's okay to ask for help. Whether it's from a partner, family member, or friend, don't hesitate to ask for support when you need it. The people who care about you will want to help. Finally, remember that treatment is available and effective. Postpartum depression is not a life sentence. With the right help and support, you can overcome it. It's important to remember there's no need to suffer in silence. Reach out, speak up, and take the first step towards recovery.